quick note before we dive in. This video is for educational and entertainment purposes only. We're not doctors. We're not telling you to take anything. And TAK-653 isn't available outside of clinical trials. Biohacking can be fascinating, but it can also be dangerous. Always talk to a qualified professional before experimenting with your brain chemistry.
Picture this. In a Takeda lab in Japan, scientists are cooking up a pill that could tweak your brain's learning circuits. The code name? TAK-653. Sounds more like a robot assassin than a smart drug, but biohackers are already drooling over it. You can't buy it, not yet anyway. But the question is hanging in the air. Are we looking at the next leap in cognitive enhancement? TAK-653 works as an AMPA receptor modulator. Think of your neurons like a giant soundboard. AMPA receptors are the volume knobs for brain signals. Turn them up just right, and you might boost learning, memory, even mood. Crank them too far, though, and the system fries. Seizures, burnout, the whole shebang. TAK-653 is also a positive allosteric modulator, fancy term for a signal booster. Instead of blasting the volume, it fine-tunes the mix, making brain chatter run a little smoother. At least that's the theory. However, Takeda's target in their clinical trials aren't students cramming for finals. It's depression, especially the tough cases that shrug off standard meds. Most antidepressants take weeks to show up to the party. By nudging AMPA and boosting plasticity, TAK-653 might work faster, helping the brain rewire itself out of a depressive loop. TAK-653 isn't the first crack at this idea. Back in the 90s, a company called Cortex Pharmaceuticals hyped up Ampakines like CX-516 as the next big smart drugs. But they fizzled fast. May results, messy side effects, and zero approvals. Later came the gray market powders, Sunifirum, Unifirum, pitched as legal Ampakines. They flopped on effects. And the safety? Let's just say, not confidence-inspiring. And now, TAK-653 is the latest reboot of that dream. Let's get into the fun stuff. One gem from early human trials. Researchers gave people cognitive tasks, including the Stroop test. That's the one where the word green shows up in red ink, and you have to say the ink color, not the word. Basically, it's a test of how well your brain handles mixed signals, like trying to text calmly while your boss is hovering over your shoulder. At a low dose, TAK-653 shifted Stroop performance, increasing the reaction time gap between easy and hard trials and slightly reducing correct answers on the harder ones. In plain English, it definitely did something to executive processing. Does that mean higher IQ? No, it's a hint of an effect, not proof of smarter thinking. AMPA is key to long-term potentiation, basically the brain's way of wiring in new memories. Boost it, and in theory, you strengthen synapses faster. That could mean quicker learning, smoother recall, maybe even a leg up on picking up new skills or languages. Sounds neat on paper, but so far it's just that, theory. Unlike dopamine stimulants, this one's not about chasing a buzz. Instead, by cleaning up glutamate's signal to noise, some think it could cut mental fatigue, making marathon focus sessions feel smoother. Less like a jolt of Red Bull, more like someone finally fixed the static on your brain's Wi-Fi. Because of that, biohackers daydream about stacking it with modafinil. One keeps you awake, the other fine-tunes the signal. Totally unproven, but you can see why the idea spreads faster than a new iPhone rumor. Since flow depends on smooth brain networks talking to each other, nudging AMPA could possibly make slipping into flow states easier. Athletes imagine quicker reaction times, gamers dream of sharper reflexes, and coders picture cleaner pattern recognition. But right now, it's still more Reddit speculation than real data. Glutamate ties into both stress circuits and sleep patterns. So some researchers wonder if AMPA boosters could build resilience or clean up messy sleep cycles. Early Ampakine studies didn't prove much, but the idea lives on. Enough to keep biohackers swapping theories in late-night forum threads. In theory land, you'll see fantasy stacks. TAK-653 plus ketamine to amplify plasticity windows. TAK-653 plus SSRIs to speed mood lift. TAK-653 plus race TAMs to push memory formation. None of this is clinically tested. And yeah, the big red flag is gray market copies. Folks microdosing an unapproved AMPA modulator without clocking the seizure risk. History tells us someone will try anyway, because biohackers gonna biohack. AMPA modulation is not like coffee. You're tinkering with the brain's primary excitatory system. Too much activity can trigger seizures, cell stress, and long-term damage. That's why TAK-653 lives in controlled trials, not supplement shops. If trials go well, TAK-653 could be a fast-acting antidepressant, with maybe subtle cognitive perks. If it fails, it joins the long list of smart drug near misses. For now, it's Schrödinger's nootropic, a potential breakthrough and a potential dead end at the same time. So what do you think? If TAK-653 ever hit the market, would you try it? Or is tinkering with AMPA too risky? Drop your thoughts in the comments. And if you want more deep dives into experimental compounds and the strange world of biohacking, subscribe. This is just the beginning of our journey here at BioHack Stack.